Good evening, everyone, and happy Monday. Thank you so much for joining me on a Monday. I don't know about you, but it's been a long Monday here in the Moore household. We just had some fun, interesting things with our sweet child with Angelman Jackson. But you all know it, you get it. So I'm doing my best to show up for you. Sorry, I probably look like I haven't showered, but you guys get it, and that's why I love you. And I'm so glad you're here. Tonight, I promised you guys every single night I would support one of the t-shirts or product that all of you guys are doing. And tonight I have my Happiness is on the 15th Chromosome shirt from Alexandra Duncan. And I also have my pretty blue earrings from Stephanie Moyer. So these are all these great things that you guys are doing. You're the most creative families and creative individuals when it comes to different fundraising and putting together awesome things to create awareness. So super excited about that. So glad you're here tonight. You have a great session. Just as some reminders, make sure you sign up for the ASF walk. We've had a lot of people ask about the t-shirt. The deadline was last week, but that was only a deadline if you want your t-shirt before September 5th. The good news is you can sign up all the way up until the very end and still get a t-shirt and a bag sent to your house. So please make sure you get those virtual walkers signed up. We have a very special rally planned for you and a special guest that you're not going to want to miss on this rally. So please come. Tonight, as always, if you have questions, please make sure you enter them into the question panel. We will do our best to answer as many questions as we can. If we can't get to your questions tonight, we will make sure that we will I'll submit them to Amanda. She'll be able to answer those questions and we will add them to the recorded list. If you missed any sessions last week, they're all already up and ready to go. So you can go to the ASF website and check out those sessions. We are so happy you're here tonight. You're in for a treat. So we haven't hit this mark in our household yet with Jackson, but I'm excited to learn and prepare as we have a great session tonight brought to you by Amanda Tourget. She is with the MGH-AS clinic. She has been working under Dr. Thiebert for a long time, but this amazing individual doesn't only specialize in this area, but she is kind of the one-stop shop for all AS syndrome issues. So sleep, GI, seizures, whatever, she is the go-to person, and you're lucky that you get to hear from her tonight. So I'm going to go ahead as we sit here. Let me go ahead really quickly and make her the presenter, and we will pass you guys on so you can hear from the amazing Amanda Tourget. Amanda, thank you so much for being here tonight. Hopefully you can now present.
I can.
There you go.
Okay, hi guys. How are you? I hope you're all doing well tonight. I'm going to talk to you about adolescents in Angelman syndrome, and I apologize if you can hear my dog barking in the background. One of the perks of working from home. So, kind of what to expect today. First of all, we'll talk about female changes. You know, girls have a few more changes than boys do going on at that time. And then we'll kind of talk about the general changes for Angelman syndrome and kind of what you can expect. So puberty, you know, that time when your body begins to change and you develop as an adult, you have, you know, physical and emotional changes, and there's just a lot going on during that time. So literature varies, but usually it starts between 8 and 13 years of age for girls and 9 and 15 years for boys. You do have that increased rate of growth, which lasts about 2 to 3 years, and you're growing faster at a faster rate than you've ever grown before. You start to get hair everywhere, so you'll start to get hair under your arms and in your pubic areas. And a lot of our kiddos will have some intense emotional changes, which are usually caused by the intense hormonal fluctuations that are happening within the body. So we'll talk about girls first, because they kind of go through a few more changes than boys. But the first physical change for girls is breast buds. That's the first thing you're going to see when they hit puberty. And then you're gonna, then they'll get labia and armpit hair, and then they'll start menstruating. So how do you know when your daughter is gonna start her period? It usually starts about 2 years after the development of breast buds. But two things that are typically very closely tied to starting your period would be getting a real bra size, meaning a cup size, not a small, medium, or large, but an actual cup size. That seemed a little more vague for me, given that some girls don't even hit cup sizes. And then armpit hair. This is the one that you really got to look out for. Usually any amount of armpit hair, a girl's period will start about 3 to 6 months after you notice the first little bit of armpit hair. So your daughter's period started. What do you do now? So there are a couple options here. You can let her have her cycle naturally every month, or some parents prefer what we call menstrual manipulation, which is just, making sure girls don't have their period every month. It's kind of delayed. So there's nothing wrong with either choice. It's a personal choice that you parents have to make together. And so things to consider when you're making this decision would be, will menstruation be too challenging for me and my daughter? Is this going to be a frightening experience for her if they don't understand what is going on? If your daughter happens to be kind of particular about things and having things a certain way, is she anxious about seeing blood? For instance, we have a gal that if she sees blood on the Band-Aid, it's kind of a problem for her, so we figure getting her period might be kind of a bit of an issue. And then how will the school help manage her period? So during that time, it's pretty common for girls' periods to be kind of irregular during the first few years, 2 to 3 years. So sometimes that goes into consideration as well when you're considering what to do. So if you're gonna let your daughter have a natural menstrual cycle, you're going to use pads or period-proof underwear or disposable underwear. Parents often have to help their daughter manage her menstrual cycle with either of these. The period-proof underwear are actually underwear you can rewash and reuse. Some people prefer the disposable kind. You just take them off and throw them in the garbage. That's kind of handy that way. Other times we do menstrual manipulation. So the 3 times we actually use oral contraceptives would be in the instance of increased seizures, which I'll talk about in a little bit, for menstrual manipulation or suppression, and then to decrease the symptoms of PMS and improve mood. So although it is very rare in Angelman syndrome, some girls do have an increased incidence of seizures as they start their first period. So we usually control these with progesterone. So as Dr. Siebert would usually say, progesterone's good, estrogen's bad. So we use the appropriate medication, progesterone only pill to control that typically. So if menstrual suppression is the goal, progesterone only pills, which are helpful at controlling seizures, are less efficacious than, at menstrual suppression. So sometimes girls will use progesterone only pills and will take them for the full 30-day cycle. And if that does not suppress their period, then they will also on top of that do the Depo-Provera shot. Of course, each of these things kind of comes with their own side effect profile. And if we're not trying to control seizures, we usually recommend a lower estrogen option. So the Mirena or the IUD, Depo-Provera, or the Nexplanon. Of course, these all come with some of their own side effects. So the IUD, as you can see, is a little insert, gets inserted in the uterus, and it actually kind of stops the uterine lining from building up quite so much. We haven't seen a lot of side effects with kiddos that get these, other than it is an invasive. It's invasive, and a lot of times girls have to go under sedation to get it. Most of the time, parents will kind of lump several things together. So, oh, my child needs dental work. We want to get an IUD placed. So they'll do both at the same time. The Nexplanon is the little guy that goes in your arm. And while that's less invasive than the IUD, it's still, an invasive procedure. And there's a large incidence of spotting with that. So some parents really have an issue with that because the spotting can occur for quite a while until their body adjusts. And it seems like they're having their period for an extended period of time. And then the Depo-Provera shot, which I mentioned, it's, progesterone only, and it has its own side effects, so weight gain, acne, those kinds of things that you see. Let's see. And the other time we use contraceptives would be to help to lower PMS symptoms. So make periods more regular. So parents will kind of understand the ebb and flow of mood cycles to help with mood cycles, decreased cramping, and acne. They help with that as well. So all of this can be kind of confusing. So when the right time comes, just ask your doctor or your NP. And Dr. Thiebert and I usually start asking about around 8 or 9 whether parents are seeing kind of a change in their daughter's mood. You'll kind of see an ebb and a flow sometimes, and kind of be able to pick up when their moods change about once a month, those kinds of things, and see those coming. And so we try to plan ahead of time and refer to the right doctors when necessary. And then, of course, if they have increased seizures, which is a little less likely in Angelman syndrome, when they start their period, we manage that appropriately with a progesterone-only pill. So now we'll move on to boys. So boys, their physical changes, they get a lot of facial and pubic hair, frequent and/or spontaneous erections, and body odor. Girls get the body odor, but to less extent. And then boys can have emotional behavioral changes such as intense mood swings or touching themselves for pleasure, which can be a problem if you're out in public. So testosterone is the hormone that causes all these body changes. So it's responsible for a deeper voice, bigger muscles, increased body and facial hair, but unfortunately it can kind of cause increased aggression or depression. So oftentimes when those kinds of things happen, we will refer to psychiatry to help kind of control those feelings. So what are you going to do with all the facial hair that your son has now that he is becoming a man? So the first thing that you can do, I don't know if you guys all know Dr. Thiebert, but here's a few examples of the first thing you do is grow a beard. So this is Dr. Thiebert modeling all of our beard options. I'm sure he's going to appreciate that I posted this on here. Otherwise, you can start shaving. So what do we do to have a successful shave? So the first thing that you're going to do is have your son start watching a male figure shave his face. Whether that be his dad, grandpa, uncle, somebody. And the next thing you can do is use a social story. So on the right is a social story. It helps kids kind of visualize what they're doing and understand what you're asking of them. So this is what we're doing, and you explain it as you go along. I'm sorry, I had something caught in my throat. And the third thing that I usually recommend is to start with an electric shaver, because a non-electric shaver is so much more complicated. And when you start with the electric shaver, you're going to start by first just having them turn it on and off and get used to the buzzing noise and the vibration of the shaver. And then you're going to progress to touching their arm or their hand with the shaver while it's on. And then you're going to, after explaining to them what you're doing, you're going to move on to their face. So those are the 3 steps. You're going to have him watch somebody. You're going to use a social story, which often parents find helpful if they post that in the bathroom, because these kids are very receptive. They understand, kind of what's going on. So it helps them know what the next steps are going to be and have less anxiety surrounding that. And then start with an electric shaver. So what is different for angels? Really, there are a lot of things that are different, but from the adolescent perspective, not a whole lot. It's going to require careful planning and earlier discussions, but with the right team of healthcare workers, parents should enter adolescence fully informed and ready for all situations. One thing I think I forgot to put in here that Amanda mentioned was myoclonus in adolescence. And I know Dr. Thiebert touched on that a little bit earlier in the week. But that is something, so typically when angels hit adolescence, we will see them, their seizures will kind of decrease, and oftentimes they'll have more anxiety and myoclonus. Myoclonus is a little bit more difficult to control, but there are a handful of things we can do. Oftentimes we'll try Keppra or Onfi if they're already on those 2 medications. Otherwise, we'll try Klonopin. But the biggest thing that we've noticed, or one thing we're starting to notice, is just lowering their anxiety and making sure they have appropriate sleep during those times, or all the time, can help lower the myoclonus for them. And I feel as if I may have talked a little quickly, but I guess we can open it up to questions. Amanda, are you there?
I am. Thank you so much. We do have quite a few questions. So let me see. Let's see what we can start here.
Do I need to turn things back over to you?
Nope, you're good. We can leave it like this for now if you'd like. The first question is, in your opinion, is it okay for the women with AS to never have a menstrual period, with an oral contraceptive to be taken continuously with no placebo taken?
So that's not uncommon for them to take an oral contraceptive all the way through, and several studies have shown that it's not a problem for them to not have their period. And the reason for that is because essentially what they're doing with that pill is that it's controlling certain hormones so that your uterine lining doesn't build up, which your uterine lining builds up and then sheds, and that's your period. So when they're taking those pills, it's not building up as much. There is some research that talks about them, having a period every few years, which I do think is okay, but I think you don't need to have one every month. Certainly it's okay.
So do you see puberty later in girls with the UPD transmission? Or another question around that is, a lot of individuals are starting to say that their individuals, the Angelman are starting puberty very early. Do you see any difference with individuals with Angelman syndrome when it comes to puberty and starting their periods?
So I don't know the question about UPD. I'd have to talk to Dr. Thieber because that's something we have to go through the data and look at. But I will say I have noticed with some of our angels, them starting their period a little earlier. And usually kind of what we'll usually see is we'll still see the behavioral stuff first. So they'll start getting a lot more anxiety and issues around that. And then you'll talk to mom and she'll say, oh, it's much worse during 1 week of the month. So then okay, period's coming. But we usually in clinic will kind of try to keep on track of that, so we ask breast buds, do they have, armpit or lady part hair? Are you seeing mood changes? And then we kind of direct accordingly.
Is it pretty typical especially for the female individuals with Angelman syndrome, for the kind of treatment option around that to put them on some sort of contraceptive?
So that's completely a personal choice. So we have some parents that are very against it, and some parents that their daughter kind of surprisingly to them started her period, and so they had to just hop right into it, and they've handled it well. One little girl I'm thinking of, they just did the disposable underwear, and she didn't like it when they were dirty, so she'd take them off and put them in the garbage, and she handled it all completely herself, actually. But like I said, it's a completely personal choice, and it's something you got to talk about. Can she handle this? Can we handle this? Can her school handle this? And how is everybody going to react to that?
So if there was a family member that was really against the medicating route, is there any natural remedies that you guys would suggest for a PMS symptoms?
So we just manage it. So when you have PMS symptoms, you have to think about what's causing them, right? So some gals they can't voice it, but you can kind of tease it out. So do they have cramps? Do they get a migraine? Is there a history of migraine there with mom? What's causing the irritability and those kind of things. And so you manage based on what that might be.
Sure. So we're getting a lot of questions about sleep. So as far as especially, let's start with the daughter started her period this summer and her sleep has gotten much worse. Is it linked in any way?
So I had one gal that had that actually last summer maybe. But anyways, so what we did is initially we looked at all the medical causes. So what was going on, because some kids, strangely enough, become a little more constipated during their period. So you got to go through all of that stuff, constipation, cramps, migraine, headache, all of those things, and rule all of those things out first. And then sometimes the kids will have increased anxiety. So you got to look at whether that might be a contributing factor. and then you move on from there. Did I answer that question, Amanda?
Yeah, so I think what you're saying is that if this individual is seeing the sleep is getting worse, maybe think about all those other things that may be happening leading up to and even after, and maybe treating some of those symptoms to see if that maybe will help with the sleep part. Because another question came through is, does sleep get better in the teen years? Like, take the puberty or the administration out of it, are you guys seeing less issues with sleep when they're entering the teen years, or is it continuing?
So actually we are. Some of them kind of turn into typical teenagers. Actually, they want to go to their room, do their own thing. A lot of them will indicate to parents it's time to go to bed, and they go off to bed on their own. I do think that those are parents that have very good routines set already. So the kid knows, like, this is what's going to happen. And so they've been doing that routine for a while, and they know it's bedtime. But I think they kind of turn into typical teenagers and want their alone time. So some of them will just hang out in their room and do their own thing.
I'm so looking forward to that, by the way. I will do anything for Jackson to sleep past 3 o'clock in the morning, right? So another question came through is, why is estrogen bad in an oral contraceptive?
So it's not always bad, but in kids who have a higher propensity to have seizures, it can cause seizures. So progesterone is a hormone that kind of stops seizures, but estrogen can actually cause them. So we usually recommend something lower estrogen, but that's not to say that they couldn't be on like a low estrogen, high progesterone pill too if their child doesn't have seizures already.
And then a question came through that says, my son is UPD. He has delayed puberty. He is 18 and we have not had to shave his face yet. He's recently just getting hair in his body. We did have him on testosterone to help him begin puberty. My son's sleep is terrible, even on trazodone. He also has anxiety issues, which are very difficult. Any help? Any suggestions?
So I think, well, Amanda, I always start with a good sleep schedule.
Yeah.
First, I rule out any of the medical causes that might be contributing to his lack of sleep. So is he constipated? Does he have reflux? And then, anxiety, we'll look at that. And then I think it's always good to have a really good sleep schedule. And then from there, then it's medications if you can't. But there are a plethora of medications you can try if you get to that point. But if you don't kind of suss out medical complications and sleep schedule, sometimes a medication can just be a Band-Aid.
Okay. So Teresa, thank you for this. She just gave me some words of encouragement, so I have to just give her a shout out. Thank you, Teresa. I'm waiting for those times for that door to slam in my face because he's over me. Because right now he is all over me constantly. So, so a couple questions came through on timing. So the question was, my son didn't start puberty until hitting 18 plus. Is this typical?
That I don't know. As far as that goes, typically before that point, we would probably refer to endocrine because there would have been some markers to refer at that point. So I guess my answer is no, we would have referred to endocrine prior to that.
So if there is anyone listening right now that's kind of in that situation, that's your advice, is that maybe talk with your clinician, and then the next step would be to a referral.
Yeah.
Okay. So a couple questions have come through with the trimmers. We kind of talked about this before we got on the call, of a lot of individuals who are starting to get older have a lot of issues with tremors. Do you have any thoughts around that, or suggestions, or what you guys are doing in your clinic around that?
So I think I start everything with this. First, we always rule out the medical stuff. So constipation, reflux, sleep, and anxiety. But what we've seen, I think lately, is that anxiety is a huge driver. That and sometimes you won't catch it, but pain. We had a little gal that had kind of a spinal issue, and we didn't catch it right away because it was something you wouldn't catch until you got an MRI. And so she was in a lot of pain. So her myoclonus was surrounding that. But what we really are seeing is it's a lot of anxiety that causes it.
Can you give some feedback a little bit on how you guys are treating anxiety? Like, what are the steps if someone comes into the AS clinic and says, we are really struggling with anxiety, or we think that may be what's causing A, B, or C? What are some of the next steps that you guys look at?
So, Dr. Siebert, so when they're real little, usually we'll get a neuropsych evaluation to start ABA, because that can really be helpful, but you typically have to have an autism diagnosis, and angels are usually too social for that. So usually they'll see a neuropsych, will try to get the autism diagnosis so they can get the ABA. And then, we go through all of the stuff. So reflux, constipation, sleep. And then once we get to that point, Dr. Siebert and I will handle a few psych medications and stuff like that before we refer to Dr. Curie.
So can you talk a little bit about who Dr. Curie is?
Yeah,
Just so the group knows.
He's really great, and he works in our AS clinic, and specifically sees kids with AS, which is really important because like we have kids that'll come in from other states and stuff, and they'll already come in on psych meds, but some of them just aren't the right psych meds, or things that you wouldn't necessarily know about this population without having experience with it. So they might be on a medication that might, cause some behavioral difficulties just because of their diagnosis. So,
well, yeah, and just so you guys all know, next Monday, so a week from today, Dr. Chris Curie will be doing a whole presentation on anxiety and behavior in AS. So stay tuned for that. A couple more questions. Do you have time for a few more questions?
I have time, plenty of time, I think.
Okay, perfect. Okay, so the question is, our child is turning 9 at the end of the year. We are wondering, what are the top 3 things that we should focus on in terms of our child entering puberty?
So usually when they come to clinic, we'll kind of assess, do we have breast buds? Do we have armpit hair? Those kind of things. And that'll give us kind of a baseline of where they might be. And then we talk to parents about making a plan. So what do they want to do? Do they want to just let her have her natural menstrual cycles, or do they want to try menstrual suppression? Because normally we would refer for that too, unless they have increased seizures with it. But a lot of kids with AS typically don't. So I would say talking with your doctor about where they are at in their kind of puberty journey, making a plan for what you want to do, and maybe seeing that referral physician if you choose to do menstrual suppression.
So how does that work as far as if they're not being treated by someone in an AS clinic? How would that look like, for them? So when you say a referral, who would they be being referred to?
So we actually refer to somebody who, she is a primary care physician, but she focuses solely on that. But if they want to do an IUD, she doesn't necessarily insert IUD. So primary care physicians can do that, but a lot of them don't, especially in kids with AS. So then we would refer to OB-GYN.
Okay, that's what I figured.
You kind of sometimes run into a little bit of an issue. You got to find the right one, because some absolutely demand that you have a gynecological exam, which we don't find, is needed.
Okay. Yeah, I didn't even think about that, right? Like the different type of exams that have to happen, and how our individuals with Angelman syndrome would do during those exams.
Yeah, so we don't think that they're necessary. So the people we send them to, we know that they're not going to require that. But there are some doctors that absolutely think that you need to do that, and it's not necessary.
So how does anxiety manifest for our kids as they're entering puberty? My daughter seems irritable a lot of the time, but we attribute it to her being frustrated with communication. Not sure what we should look like in terms of anxiety if it is related to puberty.
So usually it does present as irritability. That's usually what we'll kind of see. Parents will call and say, my child's just not themselves. They're more irritable. They're lashing out at me, hitting, scratching, biting sometimes. and sometimes we do explore the communication piece as well, but usually if they're about that age, it's pretty clear.
So do you find that there is any pros and cons to birth control long term for individuals with Angelman syndrome?
I'm pro birth control for our angels, and the reason for that is I think it's one less thing for parents to manage, one, but two, it really does help with a lot of the things that come with having your period that they can't tell us. So cramps, or it often helps with headaches if they have headaches, and acne. While some people don't care about that, some people do. So it helps with all those things. So I just think it's one less thing to worry about, and it helps get rid of all the PMS issues.
So I meant to ask this in our last question when we talked about the irritability. This is just me being naive and not really understanding the whole process, but how long before an actual menstrual cycle happens would some families see some of this irritability or things starting because of puberty?
So,
I mean, is that something you can answer?
I've seen in some kids like up to a year, and you'll notice it because they might have gotten their breast buds, right? And so the puberty started there. And so then you'll kind of see the waxing and waning of irritability based on their hormones going up and down. And then, when they start their period, sometimes it is very much worse. And usually you start your period about 3 to 6 months after you get any kind of hair. So armpit hair, lady part hair.
Okay.
So, but up to a year before, I've noticed.
This is all very fascinating to me, just because this is not something that we've obviously had to deal with yet, but it is interesting. So one of the questions that just came through is how prevalent are blood clots as a side effect for these medications for menstrual suppression?
So I couldn't give you a number on that, but that is that's actually estrogen is the cause for increased for blood clots, actually. So I'm going to say it's probably lower than regular blood oral contraceptives or other contraceptives, because we recommend lower estrogen ones and progesterone only ones. So
I'm sorry, go ahead.
No, estrogen, I just felt like I wasn't being very clear. Estrogen is typically the causing factor of the blood clots.
Okay. So I'd just be curious, out of all the patients that you have seen and you've treated with, maybe some sort of form of birth control, is it pretty large percentage of individuals that see the symptoms and the irritability go away because of that? Has it been pretty successful?
I don't think the anxiety goes completely away. That's not always controlled with an oral contraceptive, but I think that I've seen enough of, or what I'm assuming is, because they can't tell us, cramps and those kind of things going on. And heavy periods are uncomfortable. You feel bloated, so you just don't feel yourself. So I've seen enough of the irritability surrounding that go down that I think it's beneficial.
Okay. And have you seen a lot of families? So the question is, are there families that are opting to eliminate cycles altogether?
Yeah, a ton of them do. You just got to kind of find the right one, because parents love it when I say this, but every child is different.
Sure.
So you got to find out what works for your child. So, like Nexplanon, for instance, it's typically known for a lot of spotting, but some kids don't have that issue. Or Mirena, sometimes it doesn't always stop periods, or it might not stop periods for a few months. You have to give it a little bit. And so it really does just kind of depend on the child in this instance.
So do sometimes girls have hormone issues, like the cause of excess breast growth is the question. I don't know if that makes sense to you.
Excess breast growth?
That's what it says, yeah.
Do they have issues related to their contraceptive? Is that what you're saying?
It just says, do sometimes girls have hormone issues, like the cause of excess breast growth? I'm not 100% sure. Maybe I could get the person who asked the question to give a little bit more detail.
I'm going to go out on a limb and say they're asking if sometimes angels have like hormonal like imbalance and things like that that cause issues with growth and stuff. And there are a few. It's pretty rare, but we'll refer to endocrine for that, and that's always managed.
And can you just, for the families that may not know, what does an endocrinologist actually do?
Oh, our endocrinologist is wonderful. She does a plethora of things. But so endocrinologists typically manage things like, so she manages diabetes or like thyroid issues, or like some kids have like extreme weight gain related to hormonal issues. She manages all of that, which is usually a thyroid issue actually. Or like low growth, kids that need growth hormone, those kind of things. So she manages all that stuff.
Do you see a lot of individuals with Angelman syndrome with thyroid issues?
No, there have been a few, but usually those kids have kind of a bunch of other things going on as well.
Okay. So another question that's come through is, our pediatrician said most kids with epilepsy or neurological differences start puberty early. Do you find that to be true in AS? Does weight make a difference? She says, I have an 8-year-old boy who has always been chubby. I bet he's so cute.
I haven't noticed a difference in weight unless that weight is caused by, you know, a hormonal issue. And no, I haven't really noticed so much that they begin puberty earlier than anybody else.
Okay. I'm not gonna be able to pronounce this. Oh, well, someone just made that they did have a child that had a hypothyroidism early on.
Yeah.
And then another question is, what about anemic during period? How is this handled for Angel girls?
So I actually monitor iron pretty regularly anyways. So if our kids are on diet, like that's not a typical diet lab, but I get an iron panel. I check it a lot for sleep. So it's kind of just become a standard thing we check typically with labs because it can affect so many other things. So then we would manage it with an iron supplement.
So I'm just curious because I know a lot of families that are on right now, they may have an individual with Angelman syndrome that's a boy or girl heading into this time, right? And so I think one thing that I've heard over and over again is this idea of, as they're moving into this, the idea of anxiety. Like the anxiety always comes up. And so I know you've already mentioned that might not be a direct cause of hitting puberty, but there's still a lot of questions about anxiety. So can you talk a little bit more about that? Or is there anything, like, I mean, would the suggestion be to speak with, a behavior specialist when it comes to this?
So I always recommend ABA therapy for these kiddos. I think it helps any kiddo. So ABA is really positive. Otherwise, a lot of the times we do honestly end up controlling with medications. So usually we'll start with Buspar. It depends on kind of what's going on. So sometimes kids are a little more hyperactive and that causes issues versus not. So if it's just surely anxiety, we'll try Buspar first. Sometimes if they're a little hyperactive, we'll try clonidine or Tenex because that kind of covers both. I try to use medications that are already on to kind of help with things. So I do a lot of sleep work. So I do use Seroquel in sleep, and that can really help behavior. So sometimes I'll tie that in and increase a nighttime dose of Seroquel and add a morning dose. And I know Dr. Curie uses propranolol a lot, which we've been using. A lot of the times, though, I don't have all the answers for anxiety. I really turf to Dr. Curie, and I ask him a lot. He's really been great about educating me if I ask a question.
Yeah, and like I said, make sure you guys tune into that session because it's going to be really, really good. Okay, so here's another one. My Angel is almost 9, and she has been diagnosed. She was diagnosed with puberty. Oh, I'm not going to be able to pronounce this. ANDARCHE and Archie.
Oh, okay.
And she's on a Serpin implant to stop her puberty. She's heavy. Is it normal for AS kids to be obese? Would you suggest menstruation suppression? Would that affect her negatively?
So I probably shouldn't answer that question. Normally, if I get caught up on a question like that, I'll ask our endocrine doctor to let me know. I honestly haven't seen a ton of obese obese angels. Sometimes they'll get into the kind of the cyclical eating stuff that they do, which I have found is also linked to anxiety, unfortunately. So the obesity thing, we don't see a ton of that, but it does happen. And I would definitely have to ask about I'd have to ask the endocrine doctor about that.
And there has been a couple of comments that have come in just about ABA therapy overall. I think that it is something that is very individualized based, right? Like of whether or not an ABA would work for your individual with Angelman syndrome or not. I know we have a lot of people who call into the foundation who are wanting to get that autism diagnosis so they can get ABA, but there's a struggle there. So I think it's important to say that ABA may not be for all individuals with Angelman syndrome, that, I think it may fit some and may not fit others, right? There's different ways to look about that. And I think
so usually when they're having issues like that, so we usually will check into ABA, but sometimes that's not possible. So our social workers have been really helpful in helping with behavioral. So sometimes here's an example, one of our gals couldn't get ABA therapy, but they could get a behavioralist that would come to their home and help. So there are oftentimes other avenues that you can take that are not ABA therapy to kind of help with behaviors and that kind of thing.
Absolutely. And so a question's come through, and this actually came about the other day at the foundation about eliminating cycles via hysterectomy or an endometrial ablation. I think that said that right. Is that allowed since most individuals with Angelman syndrome cognitively can't be their own healthcare proxy?
I have not actually had anybody do that. I do know that if you're required to have a healthcare proxy, parents can make the decisions to do that. I've just never had anybody do that.
Yeah, I know that's come through a couple of times. So I was just curious on how you guys handle that at the clinic.
We would definitely refer for that.
Okay. Okay, so I think we're almost, let me see if there's any other questions that anyone has. Oh, here comes another one. Okay, this is a good question. We've been getting this a lot lately about our AS clinics because they're not readily in every state. So the question is, do you guys refer to doctors in other states who specialize in AS? So I'd be curious, Amanda, how we are working on what we try to do very much at the foundation is be able to connect clinicians to clinicians and also create standards of care when it comes to all these different things. But how does it work for you guys, at MGH, that if someone can't actually get to your clinic because of distance, cost, whatever it may be, can you or do you refer to doctors in other states that may be able to help, that you guys trust or may be able to work with individuals with AS?
So I don't, so normally we would recommend they go to an AS clinic that was closest to them. What Dr. Thiebert normally does is they can go see their doctor, and if their doctor is willing, they can call Dr. Thiebert. If Dr. Thiebert knows somebody in your area, he might say, yeah, go to this person. For instance, there's a psych person that is very close to several of our patients in the Midwest, so he sends to them. Or we'll say, hey, go to this doctor because it's closer. But other than that, he's very comfortable talking with outside doctors.
Yeah, I think that's really important. A lot of our families, the goal of the foundation is to have clinics within driving distance of all of our families. But for those of individuals who can't actually get to one of our clinics, we want to make sure that you guys are getting the same standard of care and that you guys have that information as well, to be able to say, this is the best way to treat seizures. This is the best way to treat puberty. This is the best way to treat GI in individuals with Angelman syndrome. And so stay tuned because those things are coming out for families. So, what you can do is basically print off a one page and say, this is the best way that we've seen of treating puberty in individuals with Angelman syndrome. But until then, you can always reach out to myself or the foundation, and we can also try to connect you with clinicians in that area that maybe help. And I'm getting a lot of questions in the question box about, is there an age limit to stop going to an AS clinic? That's a great question. It depends on which clinic you're wanting to go to. Most of our clinics will see individuals with AS. I think we only have about 2 or 3 of them that can't because it's a hospital policy. But if I remember correctly, Amanda, MGH does see individuals who are adults in Angelman syndrome. Is that correct?
Yep. Dr. Thieber sees them, birth to death. And I actually just got credentialed to see grown-ups. I just can't prescribe for them.
Oh, perfect. So that way he can take on a bigger, and you can take on a bigger patient load. So that's great. So I would say if anybody, we've had a lot of questions about the clinics during the session. Please feel free just to reach out to me and I can help connect you and get you started on that journey to be able to see a clinician. I'm more than happy to do that. So a couple more questions, Amanda, since we have just a few more minutes here before 9. First, it's a funny one. So the question was, how much wine do you think I'll need to drink to survive my kid's first period? I don't know if there's enough wine to even survive any individuals, any girl on a period. There's probably not enough wine in the world for that. I remember myself.
It's a loaded question, whether they have Angelman syndrome or not. Adolescents are difficult.
Right. So yeah. So the other question was, how do you? I don't know if you can answer this, but how do you typically diagnose anxiety in individuals with Angelman syndrome?
Based on a lot of patient history. So, we'll look at well, first of all, what behaviors they're experiencing and when they're experiencing them. Are they experiencing them, only at home? Are they, because sometimes that can be, an issue with structure. Are they experiencing them at home and at school? Those kinds of things. So you just ask. It's a very thorough patient history.
Sure. So I would also say that a lot of our AS clinics are now starting to bring on behavior specialists or psychiatrists, psychologists to help out with this issue, because we're finding that anxiety runs pretty prevalent with our individuals with Angelman syndrome. So this is hopefully something that, once again, if you can't get to a clinic, we can help as far as creating the standard of care or supporting in that way. I would definitely tune in on next Monday, because Chris Keary is going to break everything down, anxiety and behavior for you. And we also have the behavior series on the foundation's website if you're interested in getting and going on that. And we're also working on creating small snippets for you. So if you're having issues with hair pulling, or if you're having issues with biting, or if you're having issues with whatever, there is a quick 5-minute video that you can click on and see the experts in AS who are treating anxiety of how to kind of deal with that specific behavior. So stay tuned for that. A couple more questions. One question was, can self-injury be a sign of anxiety?
I think that is a good question for Dr. Keary. He is really the anxiety specialist guy. I learned from him.
Yeah, that actually, as I was thinking about the different things that may come up with our individuals, the self-injury was something that just came through my mind as we were doing that, of, is that something that our kids are doing when they're anxious? So I'll make sure for the individual who asked that, I will make sure to add that to the question on next Monday, so we can make sure that we get that taken care of for you. Okay, and I don't know if you can answer this, and once again, we're kind of talking about puberty, and I don't want to go off on too much of I think this will be something that Chris will probably cover as well. But the question is there other criteria in evaluating autism in an AS child? My son has been evaluated twice, but because he's social and makes good eye contact, they've said he couldn't possibly be autistic.
So they're asking if there's other criteria, like outside of what was used to test them?
Yeah, I'm guessing there's a specific thing that they use to evaluate.
Most of it's pretty standardized. I couldn't tell you whether, like, our neuropsychiatrist or psychologist, whether she uses the same thing that Dr. Curie does, but they're pretty standardized across the board. But that's probably a better question for him.
Yeah, and just, the person who asked this question, I know this will come up in Chris Curie's talk because it comes up a lot. We get this question a lot at the foundation. And so please make sure you tune in, and we'll make sure to get this question answered for you guys as well, because it's come up very often tonight, obviously. And so we'll make sure to get those questions answered for you. So so Amanda, as we're about ready to sign off, any words of wisdom for families who are about ready to head into this adventure that's called puberty?
I think just try to be prepared and think ahead of time. So, talk to your doctors about it ahead of time when you're in clinic, and make sure you have a plan so it doesn't kind of catch you off guard.
Yeah, and like I said, we're working hard at the foundation to create different resources for you as well. The one thing that we're seeing more is that, we're hearing is that we're needing more resources to support individuals as they head into this journey, but also adulthood. And so we're hoping to be able to release some really great resources here in the coming weeks that are going to help out with that. But Amanda, thank you so much. It's a very interesting topic. It's not one that we've really talked about much. It had many sessions on when it comes to puberty. So thank you so much for being on tonight. And thank you all for who were able to join us tonight and to be a part of this session. If you have any other remaining questions, always feel free to reach out to me and send them. I'm more than happy to answer those for you. Oh, one more question. She's pleading for me to answer. How do you recommend handling trimming and cleaning the pubic area?
Trimming and cleaning?
Yes.
I don't think trimming is necessarily a requirement, but cleaning it, good soap and water. If they're, in the shower, good soap and water.
Awesome. So it's a weird question to end on, but I promised I would ask it. So
no, it's a valid question.
Yeah, absolutely. Absolutely. Well, thank you guys all for your time tonight. I hope you have a great evening, and I'll be looking forward to seeing you guys all tomorrow for day 2 of the ASF Virtualpalooza. So thank you so much, Amanda. Have a great evening, everybody.
I have one question.
Oh, yeah.
If you meant trimming with regard to swimming, because I know that some of them really like to swim, in that case, I would do the same thing you do. I had on my slide about boys with shaving. An electric razor would probably be best, and get them used to it. So touch it on their hand and those kind of things, and if it's around their legs and those kinds of things, if that's what they're concerned about.
Perfect. Thank you. So we'll end it on that, a little lessons on trimming and cleaning. So thank you guys so much, and we hope you have a wonderful evening. Thank you.
Are you staying on afterwards, Amanda?
Nope, we're good.
Oh, okay. All right.
Thank you. Have a great evening, everybody.
Bye.
Bye.